Everybody. I'd like to welcome you all to the panel members, to the audience, and to the California Environmental Contaminant Biomonitoring Program meeting, also known as Biomonitoring California. Thank you all for participating and for sharing your expertise and experiences. The panel last met on July 22nd, 2022. The meeting included updates on biomonitoring program activities, including community biomonitoring studies. The panel, staff presenters, and audience members delved into planning for future program activities, as well as provided feedback on current activities. Key discussion topics included the utility and limitations of weighted study data, opportunities and challenges of non-targeted analyses, expanding the dissemination impact of biomonitoring study findings, collaboration opportunities and other ideas for future community biomonitoring studies, and development of a request for information to identify potential collaborations with academic and community partners. A summary of input from the July meeting and the complete transcript are posted on the July meeting page on biomonitoring.ca.gov. I'll now invite panel members to introduce themselves. I'll call on you in alphabetical order by last name. Please unmute yourself and state your name and affiliation. First, Carl Craner.
Carl Craner, Distinguished Professor of Philosophy, faculty member of Environmental Toxicology at the University of California, Riverside.
Thank you. Laura Cushing.
Hi, I'm Laura Cushing. I'm an assistant professor in the Fielding School of Public Health and Environmental Health Sciences at the University of California, Los Angeles.
Oliver Fien.
My name is Oliver Fien, full professor at University of California at Davis at the Genome Center.
Una Ho.
Hi, I'm Una Ho. I'm a professor and division head of environmental health at the School of Public Health in San Diego State University.
Ulrike Luderer.
Hi, I'm Ulrike Luderer. I'm professor in the Department of Environmental and Occupational Health and director of the Center for Occupational and Environmental Health at the University of California, Irvine.
Tom McCone.
Hello, good afternoon. I'm Tom McCone, Professor Emeritus of Environmental Health Sciences at the University of California, Berkeley School of Public Health.
Jenny Quintana.
Hi, my name is Penelope, or nicknamed Jenny Quintana. I'm a professor of environmental health at the San Diego State University School of Public Health.
Jose Suarez.
Hi, Jose Suarez, associate professor in the Herbert Wertheim School of Public Health at the University of California, San Diego.
And now our chair, Meg Schwarzman.
Hi there, Meg Schwarzman. I'm on faculty at UC Berkeley School of Public Health, Environmental Health Sciences Division, and I'm also a family physician. Thank you all for being here. It's nice to have a quorum. It's nice to have everybody here. I mean, we always have a quorum. It's nice to have everyone here. So the thing that we need to start with is a reminder for panel members to comply with Bagley-Keene requirements. And that is that all discussions and deliberations of the panel need to be conducted during the meeting and not at breaks or with individual members of the panel, either on or offline, including via phone, email, chats, or text messages. And so I want to announce the panel goals for the meeting. As usual, we'll start with an update on program activities, including the AB 617 community biomonitoring studies. And we'll follow that with a discussion to gather input from panel members and the public that will inform the program's priorities for upcoming work. And we will also be hearing from our guest speakers on the Fresca Mujeres project. That's Fresca stands for Filtration for Respiratory Exposure to Wildfire Smoke from Swamp Cooler Air. And the program, the biomonitoring program, is planning to add an exposure biomonitoring component onto that project. There, as usual, will be time for questions from the panel and the audience after each presentation. During the question periods after each talk, so you know how it will happen in this remote format, speakers, please remain unmuted with your webcam showing so that you can respond to questions from the panel and from the audience. And if SGP panel members want to speak or ask a question, please raise your hand. I'll call on you at the appropriate time. You can physically raise your hand. It would also work if you put the raise hand function on Zoom, but I'll be watching. And you can then, of course, unmute yourself and ask your question or provide your comment. If attendees of the webinar have questions or comments during those question periods after each talk, you can submit them via the Q&A feature of Zoom webinar or by email to biomonitoring@oehha.ca.gov. That's biomonitoring@oehha.ca.gov. We won't be using the chat function of the webinar during the meeting. So keep your comments brief and focused on the items under discussion. We will read aloud any relevant comments, paraphrasing as necessary. If webinar attendees wish to speak during the public comment periods and discussion sessions, please use the raise hand feature in Zoom and I'll call on you. So to start with our update on the program, I want to introduce Nerissa Wu. Nerissa is Chief of the Exposure Assessment Section in the Environmental Health Investigations Branch, or EHHA, of the California Department of Public Health, CDPH, and the overall lead for Biomonitoring California. She will give an update on current program activities and provide information related to future planning.
Hi, everyone. Give me a minute to share my screen. All right. Does everyone see that?
Looks good.
Sort of a scent. All right. Well, good afternoon, everyone, and welcome. Thanks for joining us. I'm going to spend my time giving some administrative updates about the program, and then I'll talk through some different program activities, focusing first on our surveillance work, and then moving along to our community biomonitoring projects. I'll talk about some of the activities taking place in our labs before finishing up with some work that we are doing on our new communications team. So in the past, I have talked a little bit about how our new budget has enabled us to add a number of positions. So we've gone through kind of an enormous administrative task of getting those positions created and having people interviewed and everything. So we're starting to see fruition from that. I'm very pleased to announce that we have 4 new staff people here at EHHA. We have Kelly Chen and Toki Philman joining us in Kathleen's EPI unit. And we have Kira Melton and Andrew Tan, who are part of the Outreach and Communications unit. So welcome to them all. We're looking forward to having them learn all about biomonitoring and contribute to the program. Unfortunately, I do have to announce that Adam D'Amico, who is a research scientist, has left our program. You might not be familiar with his name. He didn't have the opportunity to present at this forum during his time with biomonitoring, but he was actually a key architect of the CARE study and instrumental in our work to put together the CARE report. So I just want to acknowledge him and thank him for all of his hard work. We do have an APH fellow also joining us, an EHLB, John Gallardo, who is now working with Jean Wen and his staff to learn about and help optimize all of our lab methods. So welcome to all of you. There are still a number of open positions in the different components of biomonitoring and actually in many statewide programs overall. So I just want to highlight that there are many positions posted for research scientists, health educators, toxicologists. So if anyone on the line is interested in joining a very dynamic and very passionate group of people working on all these important issues, please visit these websites to learn about job postings or contact us. I'm always happy to talk to people about what it's like to work for the state. Oh, whoops. Oh no, I think I've gone to the website. Hold on, let me go back to my slides. All right. Well, now let me talk about our surveillance work, starting with the California Regional Exposure Study, or CARE. And we have talked about this in this forum before, that for all CARE participants, we do metals and PFAS analyses, and those analyses have been completed and results returned to participants. But there are some analytes for which only a subset of participants are included. For example, for phenols, because of time constraints, we weren't able to include all participants. So only 60 CARE-LA participants, and those were all women, and only 150 CARE-2 participants were included in the phenol subset. We also don't measure inorganic arsenic in all participants. Typically, everyone gets urinary arsenic, and we measure total arsenic in that round. But then for people who meet the 19.5 micrograms per liter threshold for total arsenic, we then speciate the arsenic, and people who meet or exceed our level of concern for inorganic arsenic are then followed up on. But this means that we have limited data on inorganic arsenic levels in the population. We have 20 LA participants and 10 Care 2 participants for whom we have inorganic arsenic data. But this coming year, EHLB is going to help us run phenols and speciated arsenic on additional participants. So that will enable us to share more data with those participants, which is a bonus. But it will also enable us to calculate population estimates and support more robust statistical analyses to look at things like demographic differences and exposure factors for those panels. Going forward, we're going to be using the Genetic Disease Screening Program banked samples for surveillance. And a quick reminder that GDSP provides prenatal and newborn screening to Californians, and approximately 70% of pregnancies in California go through this prenatal program. And that involves a collection of a first trimester and a second trimester serum sample to assess the risk of genetic diseases. And those second trimester samples from 7 counties highlighted here in green are banked as part of the biobank. So the use of biobank samples has a couple distinct advantages for us, given the difficulty with participant recruitment that biomonitoring and pretty much every other surveillance group has faced. This is a unique opportunity for us to get a population-based sample, and these samples are at much lower cost than the field collection of samples. But this also represents exposure during pregnancy, which of course is a uniquely sensitive time point of exposure. So we'll be able to get information on how this whole new generation of Californians are exposed to and impacted by PFASs. And in fact, the recent report from the National Academies of Sciences on PFAS exposure testing and clinical follow-up noted that there is not sufficient information on PFAS exposure among pregnant women, and they recommend oversampling in NHANES in the future. So I think the data that we generate from our work from the biobank will be very informative and useful. So in the past, we've conducted MAMAs, the Measuring Analytes in Maternal Archived Samples. This is first a pilot to evaluate the use of biobank samples, but then as a precursor to care, in that we approached the challenge of assessing exposures across the state by grouping counties into regions. MAMA samples were racially balanced, evenly divided between white, Black, and Hispanic and Asian mothers, so not reflective of the population. We obtained samples from 2012, 2015, and 2016 pregnancies from the regions you see listed here. And we focused on POPs and PFAS analyses for those samples, and we're actually almost to the point of posting MAMA's data from all those different phases on our website. But we've used our lessons from MAMAs to design this new phase of surveillance, studying trends and exposure in prenatal samples, or the STEPS study. And for STEPS, we are going to use random sampling or stratified random sampling to generate population data. And as I mentioned earlier, sampling from biobank enables us to generate a really solid population estimate among pregnant Californians, which we can then use to understand time trends. So our plan is to implement both retrospective and prospective sampling so we can maximize our coverage of California, both geographically and temporally. A reminder of some of the challenges we face with biobank samples. It does only include those 7 counties, so that's not full coverage of the state. The samples are serum only, and it's very low volume, so that limits the types of panels that can be run. And our lab can analyze about 500 samples per year for PFAS. And I keep mentioning PFAS, which really is the priority for this project at the time, but we do hope to be able to include other analyses as we have available sample volume and appropriate methods in the future. So for the retrospective part of the sample of the study, our plan is to focus on 2 biobank counties. We're going to link GDSP data with the Vital Stats birth record data to create a sampling frame of eligible samples. And our eligibility criteria, the mother has to participate in the statewide program, of course, and then they have to be eligible for biobanking, meaning that no Kaiser patients are included, and also pregnancies with a diagnosed genetic disease are not included. And we'll be including live singleton births and nulliparous individuals. And that's so that we can eliminate the variability that prior pregnancies or breastfeeding would introduce. We'll also limit the data in some ways by maternal age, gestational age, and gestational weight, just to frame our cohort, and also to eliminate erroneous data from data entry errors. So we've done power calculations, and we've determined that if the trend seen in NHANES among 18 to 49-year-old females holds true for Californians, then our data with our 500 samples per year spread between 3 time points should have sufficient power to detect temporal trends in most of the legacy PFASs. Because we want to be able to characterize current PFAS levels as well, we want to include the most recent samples available from Biobank. So that would be 2021 pregnancies, and then we'll work our way backwards in time to create time trends. And so our current thought is that we would include 2015, 2018, and 2021 pregnancies, but this is still under some debate. And I should say that for any one of our study design decisions, we've really debated these options, and based on literature and input from other researchers, are just trying to make the best guess as to what our study design would give us the most valuable information. But there are obviously trade-offs for any decision we make. We could go back further in time, maybe to 2010 or 2012, but we would either then miss our more current data, or we would have to stretch our time trend out over more periods of time, over a longer period of time. So we really need to think about what time period is most important for us to understand. Another example is that in selecting where we pull samples from, we've decided to go with 2 biobank counties instead of focusing on 1. And that will give us better coverage of California and an understanding of if there are differences in temporal trends in different areas. But we might be giving up the ability to look at demographics in any particular county because we just won't have the numbers of samples to look at that. So as you know, anytime you're designing a study, there are trade-offs, and that's something we're wrestling with. In a second phase of steps, we would like to sample prospectively from a non-biobank county. And this is pending negotiation with GDSP because there's not the same mechanism like biobank to save and obtain these samples. Birth records aren't available for births until 1 to 2 years post-birth, so we don't have the same opportunity to set up that sampling frame. And there's some information that we don't have until that birth record is available. So our plan is to randomly sample from the selected county, and we'll oversample, recognizing that some of the samples are not going to meet our inclusion criteria. But retrospectively, we will get the birth records for those samples, and then we can go back and identify which samples are eligible. So for example, parity information on a pregnancy is not available from GDSP. It's not available until we get the birth record. So we know that when we pull samples, there will be multiparous pregnancies in there, and we can identify them retrospectively and either decide not to analyze them, or we could analyze them and then adjust or stratify for parity when we do our statistical analysis. And certainly there are things we could learn from that data as well. And just a reminder, for the non-biobank samples, there is more volume available because they're not split with the biobank. And so there is a greater potential for additional analyses. So what this gives us, if all goes as planned, and I'm sorry, the slide is just so super busy, is that we'll have samples from 3 time points from 2 different biobank counties, and they're represented here as counties A and B. And the lab will analyze those over the next 2 years. And then in 2024, we'll sample prospectively from a non-biobank county, that's county C. And when we get to 2025, we'll be able to grab another time point from counties A and B, and then we'll move forward. So this sampling plan will enable us to do a few different things. One is we'll be able to evaluate retrospective time trends in counties A and B and compare those 2 counties, see how similar they are. We'll be able to compare 2024 PFAS levels in all 3 counties. And then going forward, we'll have time trend information on all 3 counties. I'm just going to stop talking for a minute and let you sit with a slide for a second because there is a lot of stuff going on here. And I can post that again if anyone wants to look at it later. We have been meeting with a number of stakeholders, researchers, advocates to collect input on study design, and this has been super interesting and really informative, just hearing what other people are working on and what their priorities are and how they might use our data. And this would be a great forum. We'd love to have your input on the sampling plan as well. Just a cautionary note that we can't do everything, and we're really trying to maintain our focus on our primary goal, maintain enough power to look at those time trends. So there are some limits on what we can do with this study. But our questions are, which criteria should we be considering for selecting counties for retrospective samplings? And I should say that for one of these counties, we're really strongly leaning towards Orange County, given its known drinking water and PFAS issues, and that there have been some interventions that have taken place over the last few years with wells being taken offline. So for the second county, there are just a lot of things to consider. Do we want a county that's somewhat similar to Orange County demographically or geographically, or do we want a county that's really different, like one of the Central Valley counties? Could we assume that PFAS levels are similar in the Central Valley counties and maybe think of Central Valley as a region, or do we really want to focus on one county from Central Valley? While we've been focusing on PFAS, there also are these opportunities to do other analyses. So if there's a potential difference in exposure between Orange County and a second county that we really want to learn about, that's something else to consider. We have a similar question for our prospective sampling. We are limited in that we have to work out an agreement with a prenatal screening lab to grab samples from them. But within that, what are the criteria we should be considering in our selection of a county for prospective sampling? So again, that would be counties that are not included in biobank. And finally, our criteria for sample selection have been really focused on parity, again, to control the variability that might be introduced by prior pregnancies or breastfeeding. And we're focused on live singleton births. But are there other criteria that you might want to suggest for us to consider for exclusion? And I'm going to move on from this slide, but we can put it back up during the discussion for a prompt for our questions. So I'm going to turn to our community-focused studies, and I'm going to provide some updates on the current activities for our ongoing studies, the Stockton Air Pollution Exposure Project, or SAPEP, and Biomosphere, the biomonitoring component of the San Joaquin Valley Pollution and Health Environmental Research Study. I'm also going to briefly describe plans for the next community biomonitoring project, which is an add-on to the filtration for respiratory exposure to wildfire smoke from swamp cooler air, the Fresca Mujeres project. And then we're going to be hearing details about the overall Fresca Mujeres project from our guest speakers, so I will just touch briefly on that. For SAPEP, we anticipate sending our first packet of results to participants in January, and that's going to include biomarkers of exposure, so PAHs, VOCs, and nicotine. And then an additional packet of results for biomarkers of oxidative stress and inflammation will follow later in 2023. So they'll be getting two different sets of information. We're also following up on SAPEP with an air monitoring study, which is going to compare indoor and outdoor PM 2.5 ratios before and after replacement of the school's MERV 6 filters with MERV 13 filters. And that will be in classrooms with and without portable air purifiers. And I think last time we met, we talked a lot about whether or not those purifiers were actually on or whether teachers were turning them off because of the noise. Well, the project will include the installation of data loggers on those air purifiers so that we can actually track when they're being used. And then we'll continue to work with our community partners on the ways we can best distribute the findings of the study. For Biomosphere, participant recruitment and fieldwork are scheduled to begin in the next few weeks. And the biomonitoring component of this is going to include collecting urine samples and administering pre and post sampling questionnaires, which are available in both English and Spanish. There's also an environmental sampling component, collecting air samples at participant homes and conducting personal air sampling for PM 2.5. And that fieldwork is scheduled to continue through July. So that was a super brief overview of those studies. We have talked in more detail about them at past meetings. So if you're interested in more information, We do have the project pages on our website. We have a new biomosphere page up. We also have gone into detail at previous SGP meetings, and we have links to those meetings on our website as well. And of course, Susan and Stephanie are here if anyone has a question about those studies. For our next community biomonitoring project, we're planning to add biomonitoring to the Fresca Mujeres study. And the field work for this is scheduled to begin in the spring. So very briefly, the primary objectives of the biomonitoring component of this project are to measure urinary biomarkers for certain air pollutants, VOCs and PAHs, during normal conditions, and then again during a wildfire event. The participants will be the 50 female agricultural workers that were enrolled in the Fresca Mujeres study. And this work is going to help us understand air pollution exposures in Kern and Fresno counties, and will also help the evaluation of the effectiveness of these air filtration systems. So rather than go into more detail now, I'm just going to leave it at that. We have Gina Solomon and Naomi Martinez coming after me to talk about the study in more detail. So actually in our discussion, I'll ask that you hold questions about the study until they have a chance to talk about it in more detail. On the lab side, for the environmental health lab, as I said earlier, the lab will be conducting additional analyses for the CARE study. So thanks to them for that effort. They are also going to continue to work on the method for urinary VOC metabolites, measuring 30 metabolites from 21 parent VOC compounds. This method is in its final stages of development, and we're hoping to validate in early 2023. The lab's also working on the speciated urinary mercury method to measure inorganic mercury and monomethyl mercury. They're currently looking for a certified isotope labeled standard to validate the method. They're also learning more about how the samples need to be preserved after collection. That's on a similar time frame. We hope that the method will be ready for use in early 2023. Over in the environmental chemistry lab, they've completed validation of the expanded PFAS method. So they can now measure 44 PFASs, 37 of which have a method detection limit between 0.01, 0.01, 0.05. And then there are an additional 7 analytes with a slightly higher MDL. And the new list includes Gen X and Adana, 2 of the replacement PFASs that we have wanted to track. So it's really awesome. ECL is currently using this method to analyze paired serum and plasma samples that were collected as part of the intra-program pilot study. So in early 2023, we should have data from this new method, and that will include data from these different sample media that we can compare. And finally, our communications team. I've mentioned in the past that the new funding enabled us to create an entire unit focused on outreach and communication. So this group is currently focused on finalizing the layout of the CARE report and this graphic dashboard style summary, which you can see here. This kind of handout will provide a more accessible overview of our findings, and we hope this helps us expand the impact of our work. The team's also planning to create more public-facing documents, things like fact sheets and newsletter, to make our work and recommendations to the public more readily understandable and accessible. And finally, we've talked about our plan to get our data posted in a forum that will enable researchers to take a look at it and see if they would like to use our data for their own work. And the process to get this designed and posted on the website is also in process. So in closing, I just want to mention the lawsuit that the California Attorney General has announced. In this lawsuit, the state alleges that multiple chemical companies have caused or contributed to the widespread PFAS contamination to our environment, our drinking water, and to our bloodstream of Californians. The complaint cites multiple biomonitoring California studies, starting with MEEP, one of our first studies, through CARE, all of which have found PFASs in over 99% of our study participants. We're not actually party to the lawsuit, so if there are questions about it, I would refer you to the AG's office. But the use of our data in this very tangible way to support the lawsuit is a great demonstration of the value of our work, and it's gratifying to see it. This is what we work so hard to do, and it's a great use of the data. So in sum, there's a lot going on. The program's starting to reap the benefits of our new larger budget and the expanded staff. So thanks to all of you who have advocated for us and supported us along the way. And I look forward to our discussion.
Thank you so much for that rich summary of everything that's going on, Nerissa. We have 10 minutes now just to start with questions, sort of clarifying questions from panelists, and we'll follow that with public comment and then a longer, like 20-minute discussion session. So this moment is for clarifying questions for Nerissa. And while the panelists are gathering their questions, I just wanted to start with one, which is, it's so exciting to hear about the GDSP sampling projects, and their ability to gather time trend data is just really exciting. And I had one question. I appreciated your presentation of the power calculations, because we always have that question, right? You do too. And one thing that jumped out at me was that they were based on the NHANES levels. And we could talk offline about this in more detail because we're working on a manuscript right now that presents some data that we got from the restricted data center at CDC that let us compare California levels measured in NHANES to the general NHANES levels. And for PFAS, we found significantly lower levels in the California population. So you're probably already aware of this and have compared your own results to NHANES. But if there's anything else that would be helpful, we haven't published the manuscript yet, so we could work with you if any of that information would be helpful.
Yeah, we have done our own comparison of the CARE data, of course, and then we don't have the restricted access NHANES data, but we've taken a look at all of the data we've collected through our different studies and in the literature. And we do see that for some of the PFASs, California is lower. But this is maybe a more detailed conversation than we can get into here. But I wonder if Kathleen or Dina wants to address this since it was their work.
Sure. And I just wanted to raise that we have this additional source of data, if that's helpful to you in thinking about those power calculations. I know that you all are doing a very thorough job of this, so I didn't mean to like question the work, just say that we have additional data from the restricted data center that we can share because we're about to publish it, right?
And you are able to share? I mean,
yeah, the data that will be in our publication. Sure.
Okay, great.
Yeah. We don't have anything that we can't share. Kathleen, did you want to add to that?
Yeah, and sorry, my camera doesn't seem to be working at the moment. Thank you for that. Actually, yeah, we are additionally looking for other sources of trend information to, double check our calculations. Just to clarify that we're using NHANES mostly to do the power calculation for the trend, so not just for levels, but to see. Having to make the assumption that if we see the same kind of trend continuing, would we be able to capture that within how we divide our number of samples over the number of years? To point out that, we do see racial trends in our CARE data, especially with lower levels of PFAS in Hispanic populations. So that may, because NHANES does target Los Angeles specifically a lot for enriching the Hispanic component of NHANES, that some of the sources of data that rely on NHANES within California, may have a little bit of the bias lower. But yeah, thank you for the offer. We would be really interested in making sure we look at different trend data sets.
Jenny.
Hi, Nerissa. Thank you for that talk. And I was thinking about that slide that you lingered on because you said there's a lot of numbers there. I think it was the sample sizes. That one, I think. And I don't recall if we already discussed this, and I apologize if we did, but if you're looking for time trends and you have relatively low numbers here compared to, say, an NHANES sample of thousands and thousands, have you thought about pooling the samples? Because then you could really look at the time trend with a more robust samples where you pooled samples that you said pooled 10 samples at a time or something? Have you thought about pooling samples to kind of increase your sample size, but still being able to look at time trends or not? I think that was done in the early work on the flame retardants quite a bit. Thank you.
Yeah, and NHANES does only provide pooled sample results for flame retardants at this point.
No, pooling the samples before you analyze them.
Yes.
Yeah, sorry, that's what I meant.
Right. Yeah, I mean, we have talked about pooling samples not only for MAMAs or STEPs or for other samples as well, because of the advantages you've pointed out. But I think there are some issues with, like, what does that represent when you pool? And you have to think about what parameters you'll use to define those pools and whether you can make assumptions about the similarity between those samples. Like, do you pool based on race or demographics? I mean, you would have to make some assumption that that you're not missing some variability within that strata. So, I mean, it's possible we could do this at some point. I think with our PFAS focus, we have the volume, and we should learn what we can with the samples without pooling. But I would envision that going forward, like if we've established this methodology and feel comfortable with doing pooling over different strata, that is something that we would consider doing. This kind of sample actually does lend itself well to that because we don't have a results return component of it.
Right, because I mean, you are making assumptions when you pool, but you're also making assumptions when you have low sample numbers that they are comparable as well. You know what I mean? So kind of a trade-off. Thank you.
Ulrika.
Yeah, hi. Thank you for that great overview of all the wonderful work that the program is doing. My question was, that's really striking thing looking at the genetic diseases screening program counties that are biobanked is that it's not very geographically representative. And I was wondering, is there maybe this has been talked about before, but was there a particular reason for that, or it doesn't seem random, let's put it that way.
I think it's based on where the birth defects monitoring program had set up their ongoing surveillance, but that is, I mean, the biobank is outside of our purview, and yeah, it is kind of an odd selection of counties, I guess, but that's not something that we can impact. We do hope that with negotiations with the GDSP, we will be able to expand beyond this, because I mean, there's just a lot to learn. And I think that question of whether we can assume that one county represents or two counties represents the state, we really want to take a look at that and understand, if a place like Orange County, which has had some interventions and has been very active in the whole PFAS monitoring world, whether that has a different profile and a different time trend than another county. That's something we really hope to understand with this work.
Thank you.
Jose.
Yeah, well, while we're on this slide, I have a couple of questions, but while we're on this slide, so you mentioned there that non-biobank samples may be available in a larger quantity than the 0.5. And I suppose it's really, it would depend on how agile the program is to actually secure those samples, because it sounds like they only hold on to them for like a month maybe, or
That's
how
right.
long? Yeah, 1 month, that's right.
Yeah.
So in that sense, okay. I think that opens up a lot of stuff. And I guess the question is, would they be amicable for you to store some of those samples so you can keep measuring other stuff into the future that you want?
Yeah, so let's see, there are a few things I want to address in there. The samples are roughly twice the volume, because for biobank, they split them in 2 aliquots, they hold on to 1. So we might be able to get almost 1 mil for each of those. And yeah, that enables us to do other analyses. Although in the past, we have had trouble with POPs, because for POPs, you need to do a lipid analysis and you just need more sample. So that's been a challenge to us. Non-biobank labs typically just hold on to them to confirm their genetic disease results. And then at the end of the month, I believe they clear out their storage. But what our hope is that, and we have done this before for mamas, we'll be able to negotiate with a lab so that we grab a certain, maybe it's the first samples coming through every month, or maybe it's we identify them through genetic disease and pull, some random group of samples from a particular county. But that where we can pull from will depend on the lab being amenable to setting up this kind of different mechanism. But the way our IRB protocol and our biobank protocols are written, we can use the samples for environmental chemicals. It's not restricted to PFAS or a particular analyses. And so as long as we're in adherence with our protocols for management of these samples, we can hold on to them and do additional work.
Okay, fantastic. I mean, and there are no restrictions, I guess, from say GDSP actually for how those samples may be used.
No, our protocol is fairly flexible in terms of just looking for environmental contaminants.
Yeah, no, I meant more from their side. So GDSP actually having restrictions on how you could or how much of those unused samples you may be able to actually store for the future. Sometimes they don't like that.
Yeah, I don't think so, no.
Okay. Fantastic. And then maybe I might have missed it. So for the prospective sampling now for the non-biobank, how are you planning on, so what's the protocol there? You're contacting different labs that may be doing some of this? Is that what I'm understanding?
Yeah, the prenatal screening is run at, they're called NAPS labs, newborn and prenatal screening labs. There are 3 of them in the state. And so based on what county the pregnancy is taking place in, they go to one of these 3 labs. And some of those labs have you already have a relationship with, they all have a relationship with GDSP. Some of them have some experience in saving samples for researchers. For example, in mamas, we've been able to do this with some of the NAPS labs. So in that case, we would, as we've done before, we might be able to say, well, we're focusing on LA County. So the first 30 samples per month that come through from LA County, we want to tag those to be saved for us. We haven't figured out the details of that sampling protocol yet. We're really focused on the retrospective right now since it's coming up sooner. But I think there are a variety of ways in which we could choose to sample.
And you do have in your IRB, and actually, are you provided with identifiers of participants?
So we have not their names, we do have their addresses and a selection of information about the pregnancies, about the parent.
But you have access to the birth records eventually after 1 or 2 years, right? And
Yes.
you would have information of names and addresses and all that stuff from there eventually.
Yes.
You would suspect,
yes.
right? And you wrote your IRBs to account for that you might be getting this identifier information, because I think it's very valuable to have that information if you want to do follow-up of the same participants later on or go for other research purposes.
Oh, I don't think we are allowed to do follow-up with the participants, and maybe Dina is on and could speak to this a little better. We don't have anything the way prenatal screening permissions work for saving of their samples is people opt into the saving of their sample for research, but it's a sample only. The participants themselves are not involved with our study, and there's no contact between us and those participants. So there's not an opportunity for us to go back, for example, and ask questions of those participants or to do follow-up sampling.
But if you have the contact information, I mean, technically somebody else could potentially do a follow-up on those participants, or maybe it's part of a different project, if it would be a name of a new project, right?
I don't think we have the permission to contact them though. So I think that would, yeah, I think in the way they are consented into the research bank of Biobank or into actually even just doing prenatal screening, I do not think would now allow us to do a recontact, even to recruit them into a subsequent study.
Okay.
I see Dina has her hand up though. She has more recently looked at this. So Dina? Sorry, Meg, I'll let you go on.
No, please, go ahead.
Hi, this is Dina DeBraca from California Department of Public Health. So in our IRB protocol, we have to justify every variable that we receive from Biobank and explain how we're going to use it. So we are not receiving names, but we are receiving other identifiable information such as an individual's date of birth, an individual's pregnancy information, an individual's address. And we have explained that we will be using that information to understand more about an individual's environmental exposures, or because it's an important confounder such as age or parity to understanding this relationship. We also have to put in our approvals if we would ever do any linkages with this data in the future, when we have to provide that justification to both the state and to separately the Vital Statistics Advisory Committee. So to all of our approval agencies, we have stated that we are not linking any data for it to become identifiable to those individuals. So that is the limitations on our approvals.
Okay, and just a quick, I know that there's going to be maybe, or should we pause questions here? I don't know if you want to move things forward with other stuff, but I have more questions in that regard.
Jose, I think you can go ahead. Once we've finished these questions, we'll open it up to public comment and then have additional discussion time, but we're not tight for time.
Okay. I think I'm thinking of the other side of things, right? I tend to do a lot of research on prospective cohorts, and this seems like a very low-hanging fruit where even a birth cohort could be started at the snap of a finger, pretty much, since you're already collecting this information, which could open up the opportunity for a lot of other investigators to start doing something like that, which might be something interesting, and happy to have more discussions about it. But if there's a possibility, at least of having some sort of a way to then eventually link it back to the information within the birth certificates, then that could open up a lot of different collaborations and opportunities. Even though you may not, it's not an objective of yours to do the follow-up of those participants, but it leaves that opportunity for other investigators to maybe start getting in that direction, or who knows, maybe into the future, it may be of interest to the program to do a follow-up of the exposures of the same participants. So if there is some way to start thinking about maybe an amendment even to some sort of IRB protocol, if that's of interest to you, I think it could be a way to not go into this missed opportunity of collecting some of this valuable information. Now, is there, with the information that you are getting from the birth records, is there some sort of identifier, even though you don't have the identifier per se, but is there some sort of code that you could, into the future, then link it to the full contacts information that is available in the birth records?
So there are two kinds of things. I guess these are not totally overlapping types of studies. I think there are ways that we can use, and we've been clear in our IRB amendment that this would be a separate study, that somebody could take this data and link it to additional databases and do that kind of outcome work. So that is already a possibility. I think, again, for the the recontacting of participants, that's something that I think really doesn't fall within our purview, because the initial consent is happening at GDSP. They're a different program, and I don't know how. I don't think we can really control that. I mean, it's certainly something we can discuss with them, and maybe there's some study within a study we could do, but I think the way it's set up now, that would be harder to pursue. But I do agree with you that there's a lot of potential for this work to link with other administrative databases and look at various outcomes, and also use that locational data to look at things like geographic impacts. So that's our hope, that this is really going to be a foundation for many different kinds of research that can come from the data that we produce.
Thank you.
Let me check in about public comment. Has anyone, I don't see any hands raised for comments or questions. Is there anything on the website or email that we should know about?
No, nothing that.
Okay, in that case, we have time to continue the panel discussion and input. And I wonder if, Nerissa, you would put back up, the set of questions that you have about the sampling plan input that you wanted, and see if panel members have any comments or suggestions or any input they want to provide on this. I mean, one thought that I had, you asked for just opinions about geography of sampling, and certainly knowing what we know about where NHANES tends to draw from, and then the location of the biobank samples. I guess there's the tension that you mentioned between sampling in the same places to see time trends versus sampling in different places to get a better view of the state, more representative view of the state overall. And I may have missed some of the details on this, forgive me if I have, but my inclination is if we can get time trends data already from the biobank samples, it would be great to use any prospective sample collection as an opportunity to increase our sort of the geographic distribution from around the state. I'd be curious to hear how others feel about that. Ulrika.
Yeah, I'm sort of following up on that. I was going to also say that, as I meant, obviously there's a geographic kind of non-randomness to the counties that are biobanked, and using the prospective county to kind of broaden that geographic distribution, I think would obviously make sense. But then the question that you raised then is if it's just 3 counties, and I agree, then that doesn't give you it's not necessarily representative, those 3 counties of the state as a whole. So I mean, that's a tension that there is. I think if it was going to be 3 counties, I would favor the same 3 counties to be able to get, better time trend data for those 3 counties. But I'm curious to hear what the other panel members think about that.
Jenny, go ahead. Oh, sorry. I have Jenny and then Jose.
Hi, thank you for that question and your comments, Ulrika. I was thinking back to Nerissa, you said you're interested in Orange County because of the water contamination. So I seem to remember that you guys presented a quite detailed map of water supply for certain areas. Maybe I'm getting mixed up with a different meeting, but where the water sources were. And if water sources are of interest to investigate, then I feel like they should oversample people on different water sources, on private wells, on small water, community water works, if rather than a bunch of people all drinking LA water that's all from the same source. You know what I mean? So I would think I would oversample people on wells and private water systems. And I would also oversample for rural participants who are, as you mentioned, really somewhat left out of, underrepresented perhaps in NHANES. So I would think about rural participants as well.
I want to just insert here one quick question that I had overlooked in the Q&A on Zoom, which is just to make sure our subjects getting compensated for their time.
The participants are not participants of our studies, they're participants of the genetic disease screening program. So they're undergoing screening and they are consenting to have their samples saved for research. And that's the end of their participation, as they know. So there is no interaction between us and the participants.
Thank you for that. Jose had a comment and then I have Laura.
No, mine was very brief. I was agreeing to Ulrika's suggestion of keeping the same geographic units or same counties if you want to look at trends. That was all.
Okay, great. Thank you. Laura.
I was thinking about, I presume you hypothesize drinking water is the primary source of exposure for PFAS. I don't know if that's true, but you know, Kern County has a lot of oil and gas drilling. I know they use PFAS in fracking, which isn't super common in California, but I don't know if they use PFAS for other activities, but that might be something to look into in terms of trying to choose a county. And there's also, I agree with Jenny, you might want to focus on places where people are drinking. Well, I don't know if we know like whether groundwater or surface water tends to have more PFAS contamination, that might be another way to narrow in. And, you know, the Southern San Joaquin Valley is like Tulare County, I think it's like 95% of people drink groundwater. There's a high proportion drinking untreated groundwater, either in a private well or in a small system. And I have some data on that if that's of interest in terms of where people are drinking from domestic wells. We've tried to estimate that statewide. So maybe potential sources of PFAS and then also sources of drinking water might be things to consider in the retrospective sampling location choice.
We would love to talk to you more for two of the points you've mentioned. One is that we have been trying to learn more about oil and gas extraction and how PFAS are used. And I believe there is now a reporting requirement for oil and gas extraction sites, but I'm not sure what compliance is like, and I'm not sure if PFAS are one of the reportable constituents. And so just learning about that whole reporting side is a whole complicated question, but we would look certainly Kern County with all of its sites is of interest. And then we would love to talk to you more about water source. We're finding that the drinking water data is very, very complicated. And certainly across the state where there is data on drinking water, there are detects in many different places, but the MDLs are different. The availability of data is really different. And so it's been difficult to piece together what are the most significant places to look if we do think that drinking water is the most significant contributor, and whether it is or not really depends on what your drinking water looks like too, right? So it is, you know, there are lots of things we're trying to consider in this selection, but that would be really helpful to talk to you a little bit more about the water mapping that you've done.
Great. Gina Solomon.
Yes, thanks. I'm sorry to jump in, but I did want to mention that we're just completing a study called the Tap Water Analysis Project, funded by the California Breast Cancer Research Program. And we collected tap water samples from primarily small water systems in different parts of the state. And we actually, it wasn't a ton of samples, a total of 60 different, samples, different areas. We expected to find PFAS. The analysis, the targeted testing was done by USGS laboratory for 34 PFAS. And we actually did not have hits in the Central Valley, but we had a lot of hits in Southeast LA. And one of the interesting things about LA is that there's LA DWP that covers a large part of the city, and then there's a lot of very small water systems that mostly use groundwater in the industrial areas in the southern part of LA. And so you can find some, we found a lot of different PFAS down there, and we'd be happy to share the data if that would be helpful. All those system boundaries have been mapped, and so it's possible with address information to figure out which system people are in, and that could be interesting if LA County were selected.
Oh, that would be really interesting. One of the challenges is that the data available, some of it's from tap water, some of it's from wells, some of it's from, like pre-treatment or post-treatment, and just sorting through all of that has been a real challenge. So we would love to talk to you about your data. And maybe, I think Kathleen's probably weighing in on this as well.
Kathleen, do you want to offer something to that before OEHHA?
Oh, I was actually going to add a slightly adjacent point that because we have information on Los Angeles from the CARE-LA study in 2018, and then Eastern and Southeastern counties in CARE-2, that we've actually already started working with the Water Board to match up the PFAS data that they have there. Again, the variety that Nerissa cites of the types of information that are available, and the conclusions one can take is been complicated to work out, but we are already starting to look at the correlations between our participant information and the water data. Well, we're in the beginning stages, I should say, but it's a complementary activity to what we are talking about right now.
Thank you. OEHHA.
I just have a couple of comments. Just recently I learned one of the things is that it's when you select the sites, is it something like, I mean, in California, that the wildfire and all this fire responses happens, those kind of regions are kind of could be considered for testing the groundwater or surface water over there. It may be possible, some source. This is just my thoughts. Another thing is that, you know, the Nerissa, the PFAS, you know, the kinds of the PFAS, you know, PFAS where just there's so many. It's just incredible that, you know, all the labs can measure, you know, the PFAS at the very low levels. Are there are the small chain of PFAS are included in this analysis? Because I recently learned that those are really, really abundant in water source too, and air and water. Yeah.
Yeah. I think, are you talking about Amina's work? Because there was a recent presentation about all the C2 and C3 and the prevalence in the bloodstream and trying to figure out what the source of that is. I think I have a slide, an extra slide here. These are the analytes included in the new ECL method.
Okay.
And I would refer, hopefully there's somebody from ECL who can weigh in on this.
So the 4-carbon chain is the smallest that we're doing.
Okay.
And sorry, to clarify your point about wildfire response, was that in terms of suggesting that we look in counties where there has been a wildfire response, and if AFFF or if PFAS have been used in that wildfire response, that would make it a county worthy of looking at.
Yeah.
Yeah, it's all, I mean, all good things to consider. But of course, like, I guess water assessment is really how we're getting at that, because that would be really the primary exposure to the population.
Thanks, Jenny.
Hi, we're talking about water sources, but of course, what people actually drink is the most important thing. And this is not my area at all, water, but I'm just kind of curious, do they have good data on Californians' behavior around drinking tap water? Just for totally naive point of view, I would assume that wealthier areas would be, you know, out there with their little filtration units or what have you, and then the lower income areas might just drink tap water more. But I'm just kind of curious, do they have a good behavior data about water consumption, especially how it might differ between urban and rural areas? I don't know at all. I'm just asking.
I think they do ask questions about water source and things like BRFIS and the CHIS statewide surveys. So that would be more of a population-based assessment. We do ask that question in our CARE study. So we do have a sense of our own participants. And we did hear from a lot of people in LA, but especially in Region 2, that there was a lot of bottled water consumption. Actually, and it wasn't like necessarily correlated with, oh, I know there's something in my drinking water, but there's more of a it's almost cultural that, like, don't drink the regular water, go out and buy your water, even though it's quite expensive. And so I think in CARE, we will be using that as a way to look at how our participants' PFAS levels and their drinking water matches up. We'll be taking that into account.
Thank you.
Jenny, I did want to comment on your comment on rural, and I think that is something that we don't often get to. It's very hard to recruit in rural areas, and there's so many really important things, I think, to learn about rural communities. It's unfortunately not one of the data points we have in vital statistics or GDSP data to be able to select for that. But I wonder if, like, by focusing on Central Valley, and if we can get enough numbers, we might be able to then kind of sort through our data retrospectively and figure out who is on private wells. And I think that would be really important to look at, especially in places like Tulare, where there is, you know, fire training grounds and a lot of industrial sites.
Thank you.
Any other comments, questions, discussion points on this planned program? Or anything else that Nerissa presented for that matter?
Well, thanks everyone for the input. I mean, we just got our IRB approval and our biobank approval, so we're really excited about this. And it's just great to have so much input into how the data will be used, but also just things we should be considering in the sampling.
Great. I think Jenny had one more.
Sorry, I raised it right before you made that wrapping up comment. I didn't mean to derail you. I just was looking at that last question about additional exclusion criteria. And it made me think about your sample. Do you have, maybe you said this and I'm so sorry if I missed it, but do you have any data on the mom, like breastfeeding data or prior breastfeeding, or if they're first child, first pregnancy, not first pregnancy, because that would affect some of these, you know, water fat soluble compounds. I'm just curious, and what exclusion criteria do you currently have? If you wouldn't mind telling me again, I'm sorry.
Yeah, sure. So we do have, for the retrospective studies, the retrospective sampling, we will have parity. So we'll know how many babies to term this person has had. We don't have breastfeeding information, so that's why we are excluding multiparous individuals. We're only sticking with nulliparous pregnancies. For the prospective sampling, though, we don't have those birth records linked until 1 to 2 years after the birth. So we're going to oversample retrospectively, then we'll be able to link to the birth record data. And we'll either, I'm not clear how this is going to work, but our plan is to either identify multiparous samples and take those out of the queue, so we won't analyze them, or it's possible, depending on where we are with our analyses, that we'll go ahead and analyze them and then adjust or stratify for parity.
And those were your only exclusion criteria? They didn't have others?
Just live singleton births, so any multiple births like twins or triplets we won't be including.
I see.
Well, I guess a question related to that is, well, what kind of information do you have? Additional information would you have?
Oh, I'm going to call in Dina because she can rattle this off.
So once the linkage between the prenatal screening program and the birth record occurs at GDSP, and once the data is linked, we've received approval for most of the variables on the birth certificate.
Okay, so then I guess for the prospective, you wouldn't be, so this is like part of exclusion criteria who you're going to include or not, but you want to have those data for another 2 years after the samples are collected.
Right.
So then you wouldn't know who you would actually include into the study for another 2 years, right? So I'm just trying to understand the timeline here for.
Correct. So because the NAPS labs only retain the samples for a month, we have to take the samples as they come. And some of those samples will not go to term and therefore will not be part of the final California birth file for the year. Some of those individuals will move during their pregnancy and therefore move out of the county of residence between their prenatal screening program and when their address that shows up on their birth certificate, and therefore would be excluded retrospectively. And so, yeah, because of the way that the sample collection works, we can't exclude until the data is linked after the fact.
Right. So then to reach your targets there on that slide that we had, the number of samples per year, I guess that's for the retrospective, and then the prospective. I'm just looking at that there. So it looks like for the prospective, you're starting with 500, a target of 500 in 2024. To reach that target, I'm guessing that you're going to have to collect a lot more samples, and then later on you're going to be doing the exclusions, right? Is there a certain number of samples that you're targeting or that you can actually store? I guess 500 is not that much. So maybe, yeah. What are you thinking in that regard?
I think we'll have to calculate that based on our exclusion criteria. We can look at the county and we'll have pretty good data on the percentage that are multiparous versus nulliparous. So we'll do that calculation when we get to that point. The storage of the samples isn't the issue. I mean, we do have to purchase them, so there is some limit on how many samples we can get. But we do plan to oversample, so that we'll still end up with enough samples for our analyses.
Is there parental occupation in the birth certificate?
There is maternal and paternal occupation and industry that is available as a request from the birth files.
Okay. Well, and this kind of opens up the other thing that I was thinking is depending, so something to give some thought to is there are certain groups like firefighters, of course, that have a substantially higher risk of exposure to PFAS. And the more of those you have in a sample of 500, the more that could sway things, right? And especially, so it's something to think about whether you want to include high-risk groups within the sample. I guess you're more interested in looking at the population trend, and of course populations have mixes of different people, some with very high exposure and some with low. But you do have other studies specifically of firefighters, right? And so it's something to maybe give a little thought of, is to what point you want to potentially exclude those groups that have very high exposures, just to try to get a better sense of what the background exposures may be.
Yeah, I think it depends on what your primary study questions are. And for surveillance, you know, we do want to get a population sample. But if there's enough data at some point, sure, we can ask other questions given all the different demographics or occupational information that we have. But we're trying to stay population based for the sampling.
We have just a couple minutes here before a quick break at 2:15, and it's just a 5-minute break. So I want to make sure we get to Ulrika's question or comment. Oh, you're muted.
Sorry about that. I think you said that for the biobanking, only the second trimester samples are saved. Is that right? So then are you planning then for the prospective study to also choose second trimester samples, or, you know, is there maybe any utility? I mean, a lot of these, certainly the more legacy PFAS, they're very, very long lived, have long half-lives. So you wouldn't expect a difference, you know, between a first and second trimester sample necessarily, maybe, but certainly some of the newer ones have shorter half-lives. So, you know, maybe there's some utility to looking at, you know, first and second trimester within, you know, maybe a subgroup. It's just, you know, something to think about.
Yeah, we would love to get first trimester samples. The state has just brought on a new screening program by which the first trimester samples are actually going outside of state to a different lab for analyses. And I don't think they will be accessible to us, but it's certainly something we have asked about and have kind of on our wish list, because that would be great information to be able to get.
Yeah. Too bad.
They didn't design their program around us, unfortunately.
Jose, I'm sorry, I didn't realize you were about to say one more thing there. Was there anything else? We have 2 minutes before we have to break. Was there anything else you wanted to add?
Yeah, no, I guess my question was mainly, since the question was about what additional exclusion criteria there may be, that's what I was bringing. Would it be advisable? And I'm trying to still come up with a decision on that, whether to exclude those high-risk groups since you do have information about parental work.
So high exposure groups.
Yes, high exposure groups.
Yeah, I mean, I guess it would, I mean, what would that tell you then? I mean, how would you compare that to other surveillance numbers if other surveillance numbers were population based? I think that would be, and where would the cutoff be? What would you consider a high risk for exposure group? So I think it's tricky and sort of a difficult thing to then figure out how to use that data once you start picking and choosing on demographics. Although, I mean, I think it's an interesting question about how those groups would compare, and certainly stratifying and looking at all your firefighters in comparison to everyone else would be interesting.
I mean, it still is population based. It's just excluding maybe very high risk groups that could potentially sway the population level curves if you have enough of them, right?
Right.
I appreciate Nerissa's point. Oh, sorry. I was just going to say, I appreciate the point, Nerissa, that we don't know what all the high risk exposure groups are. And so that would be just sort of selecting the couple that we know rather than, maybe there's some very extreme exposures among drinkers of well water or whatever. And we haven't, it's not like we've categorized all the high exposure groups. So it's maybe being a little bit, it's selecting, but with our realistic blinders on. That are just a function of what we know now.
I think it introduces a difficulty also. Let's say California numbers are lower than everyone else's. Is it because our numbers are lower or because we excluded all the high exposure people? So I think it's difficult to interpret once you go down that route. I do want to just highlight that there is one other exclusion criteria, which is that samples that are associated with pregnancies with an identified genetic defect, those are not included in biobank. So those are also not, I mean, they're excluded just because of how biobank works.
We need to break now. It's just a very quick 5-minute break and we're going to start right back up at 2:20. Thank you all.
Thanks everyone. That was really informative.